Hello everyone, I am Dr. Kaushik Chatterjee, Consultant Gastroenterologist, AMRI Hospitals Dhakuria, Kolkata. Today's health topic is constipation, one of the commonest GI complaint all across the world, India, and maybe more importantly to the eastern side of India. Millions of patients do suffer from this problem over years and keep on taking medications over the counter without ever being evaluated or investigated. We all understand what the troubles the patient may undergo over the years who is suffering from constipation, especially people who are elderly, who have a recent onset of constipation, who has anemia or low hemoglobin, who has a history of blood coming along with the stool, who has significant weight loss over a short span of time, which is unintentional, who has significant pain abdomen associated with constipation, and who has a lump per abdomen, definitely require investigation and evaluation for constipation. Broadly speaking, a constipation can be because of some organic pathology where there is some blockage to our anal canal, might be related to something as serious as a cancer or an inflammatory bowel disease, or more other different kind of causes, maybe a celiac disease, maybe metabolic dysfunction in the form of a thyroid dysfunction or a hypercalcemia. All these can contribute to your constipation. The other group of patients have no obvious blockage to their passage of stool. They may have slow transit in their colon or the large bowel, or they may have problem in propelling the stool out from their rectum to outside, which is basically a defecatory disorder. And a large proportion of patients do not have any of this, but they still complain of constipation. Over the years, people have realized constipation is not just the decreased frequency of stool, that is passing stool every 3 days or 4 days, people who have an incomplete feeling of bowel evacuation, people who have a feeling of blockage in the anal canal, people who have straining during defecation, who pass hard lumpy stools, can also be included in the definition of constipation. And people can also have some loose stools spontaneously without medication despite being primarily having a constipation. Over years, these changes have been recognized, and people are encouraged to undergo evaluation if in appropriate situation. The investigation for a constipation patient usually starts by ruling out organic causes, which includes a colonoscopy examination or at least a sigmoidoscopy examination, blood investigations to rule out your thyroid problem or other metabolic factors. Subsequently, there are investigations like anal manometry or a diffecogram. Diffecogram might be a conventional one or an MR guided one, which can help doctor to understand whether there is any problem in bowel evacuation. There are more sophisticated investigations in the form of colonic motility study, which can help us understand exactly why you have constipation. All this help a doctor realize the problem or the basic mechanism which is abnormal in a patient and help them prescribe medication accordingly, which definitely gives the best result to the patient. A very small subset of patients might also benefit from surgical treatment for constipation. In general, a patient with constipation is advised to do some lifestyle changes, is encouraged to have an active lifestyle, take plenty of water and fiber, and the fiber is also supplemented in the form of any isabgol or other supplements. People who do not respond are prescribed different varieties of laxative. Subset of patients who have pelvic floor dyssynergia or surgically correctable conditions will benefit from different kind of therapy. It is advised and encouraged people who have especially the alarm features which I mentioned previously should see a doctor, get evaluated and treated appropriately rather than taking medications over the counter for a very long time. Thank you.